How to read the schedule. Under the schedule tab, you'll see that it defaults to today's date, or you can hit today to get back if you happen to click out. Over to the side, it will show you the future schedule and a calendar that you can click on, and then it gives you options to hide that calendar to give yourself more space, or you can click to bring it back. You can from here create a new appointment. That is something that you can do. We'll show you a little bit easier way to do that as well. And then new events. Events are things like our save for day blocks or our lunch blocks. So not something typically put in unless something is special on that day. There's also a section that's nice. That's called the appointment deletion log. For the day, if something does get deleted or changed, it will log it here. That helps just in case we accidentally click and drag a appointment to someplace weird and we are questioning if that was a client requested move or if we accidentally did it, and that would be listed under here. It will also tell you if something was deleted or canceled. How our system works is people will get reminders via email and then the day before a text message, and if they hit C to cancel, it will automatically delete it and then let us know here. Versus if we do it, it'll say deleted by so-and-so and whoever the staff member is who deleted. So that's useful information. Every day we'll have different views. So we do dentals Monday, Wednesdays, and some Fridays. And you'll see that because this faint yellow will be on the schedule for those days. If I click ahead to a different day, you will see that there's a faint yellow here. This tells you two things. It tells you only dentals can be scheduled on this day, and it tells you when to start appointments as well. So the first appointment on this day can start at 8:30. We do dentals and appointments concurrently, but surgeries, which are Tuesdays and Thursdays, we do not. We have the entire morning booked for surgeries, and we don't start the first appointment until after our lunch block, so it would be a 1 o'clock. With that, you can override these and put things on top, but that's usually done by myself, if I give approval, or if we discuss and have a change that needs to be done and I ask you to. But for surgeries and dentals, we definitely can click and put in dentals and surgeries on their specific day. Surgeries, we typically do 4 surgeries, and dentals, we pretty much do 1 to 2 depending on our comfort level, so that may change. I would definitely plan on 1 for now, and then we will go from there with training. So those you need to watch. On dental days, we cannot do secondary procedures. If someone's asking for a lump removal with a dental at the same time, that needs to be put on a surgical day instead of a dental day. Dentals are truly just dentals because dentals are done by the technicians instead of the doctor, and I'll be seeing appointments instead. So make sure we pay attention to that. The surgeries, we also make sure to put however many slots are needed based on the procedures. If it's a lump and a dental, that would actually count as 2 different anesthetic events and take 2 slots out of our 4 slots. So that's something that we just need to watch for time frame purposes. The second column here we have is called the technician spot. The technician spot is where we put information on technician visits, such as rechecking blood work, usually what we're doing, what all is going on, Librela injections, Cytopoint injections, lasers, toenail trims, anal glands, all of those get on the schedule and they will be in this column. What we do try is to watch scheduling technician appointments during lunches. We alternate lunches and try to get everybody out the door for an hour of lunch, and that usually can start at 11 o'clock. Usually people are going at noon and at 1. So we're trying to make sure not to put too heavy of things here, knowing our staffing will be less during this time frame. As you can see by the colors, each appointment has a different color combination. we'll go over what all these mean in just a moment. But one final thing is the end time can be different per day. So this day, you can see there's a black block here. So from 5 on, it's blocked, so we can't put any appointments. But during the school year, I may have to leave to go get my 3 children from school, and you might see a faint black or gray line, similar to what you see for this lunch. That is also an admin block that is for me going to pick up my kids. So please watch and pay attention. Also, there might be notes up at the top that give you specific directions for that day, such as do not schedule dentals, do not do X, Y, or Z. So make sure just to always, as you're scheduling, read the top, make sure that there's nothing different there that you need to pay attention to and change. So going into what are the different blocks here, this is the light purple is acupuncture. And you can see here that we are doing a side-by-side 2 appointment. So this is how we schedule multiple pets. We want to make sure that they both have the same start time. That way when a client gets the email reminder, we're not having a confusion of, oh shoot, I read the 9 o'clock email, not the 8:30, if we put them back to back instead. So we always want to put them side by side, and you can continue to stack patients next door. You just might have to manually adjust the time so everyone has the same start time. There's wellness. We have 2 different wellness options, simple and complex, based on how old the patient is, how many problems they have, so it depends on how much time we need. We try to keep these pink save for day blocks throughout the schedule. These we only open the day of, and we save them for urgent care examinations. We prioritize our own clients, so if everyone's calling at 8 a.m., if it's a new client, we can put them on a cancellation list and call them back if there's an opening, but we try to prioritize our own clients during the busy seasons. We also can use these in cases for euthanasia. So if they had called the day before and had requested euthanasia for their patient, we can take a save for the day for that reason. Or if in doubt, you ask me, the veterinarian, to see when we can adjust and do a euthanasia. So if in doubt, always ask. What we have here too, this is an examination, so it defaults to a different time frame and a different color. This here is the initial acupunctures, which should always be an hour, compared to subsequent, which are anywhere from 30 to 40 minutes depending on the patient. And then we have openings here that can be filled with the rest of the appointments as well. Inside of this, you will see that every time it will give you the client's name, patient name, and why they are coming in. Make sure that you fill that out completely when you're setting an appointment so we know what they're doing and what's going on. The blue, if we hover over it, it'll tell us it's planned. When things are confirmed, what you'll see is that blue will switch over to a checkbox that tells us that it's a confirmed. Whether we called a manually confirmed or if the text message received was confirmed. Other things that can be here, it'll tell you if you hover over, this one's in progress, it's being worked on, and then completed, it fades out and turns to a gray. There is also a little tab where it looks like a person is in that box, and that area, it's very faint here, but you can make it out. That is something called a self check-in. So that is intake questions or history form that can be sent ahead of time where owners can have it filled out before. So we'll go over that a little bit more. And then you could see the difference on this deletion log on how complex this day was and how rearranged it did get. So it documents all that for us. Other things too that you'll see on here is that if you click on the appointment, it expands and it'll give you information about the client, the patient, how old it is. If there's any alerts, you'll see a red triangle here. This tells you what type of appointment it is. This is a simple wellness. Tells you who the provider is. This is a relief vet that's currently in the office, but usually it defaults to myself. And then it tells us it's confirmed. This is also where we could manually do that if we were making the phone calls. And this is the self-check-in form that I was discussing. So this will make more sense when we dive into encounters, but you can text or email that self-check-in form right from here. And then this also tells us when this was created and by whom, another important reason to be logged in. And then this one, we don't typically use this room number, so we can ignore that. And this is when they do come in, where you would go to start the appointment and open the encounter. The delete one, you really want to make sure that you truly want to delete it. If they didn't show up, you actually will instead change that to a no-show, so it documents inside their record instead of just deleting it. And then if you do need to delete, they just canceled, you can put a note, canceled, and then delete from there. That is just fine. Or you can hit canceled here so it documents and keeps it. The pencil is important, so if you needed to add more information about why they were coming in, that you can come here and get access to that same area. If you need to manually adjust the duration, you feel like this appointment needs to take more time, or you had it as a simple wellness and after talking we realized this appointment's going to take longer than 20 minutes. Let's adjust that to a complex wellness. That's where you would adjust the type. As you can see here, we have all the types listed and their colors that go with it. Rechecks, euthanasias, drop-offs, dentals, exams, the different wellnesses. We do have a specific one for new clients. That way it kind of signals to us we need to make sure things like the past history is obtained. It sends them a different questionnaire and consent form for just information about our clinic. So those are important. Glucose curves, general surgery, spay-neuter surgery, lump removal surgeries. The other important thing is when they're actually here in the clinic, we utilize these steps to verify information. So if you click on that, you can add the email. We're missing this email, so this is a great opportunity to do that. Check and make sure we have their mobile number. We need that for our text messages. So this is important to do when they check in every time. And then vitals, we have it here just mainly for the weight portion. So when they're on our scale, you can click here and type in the weight and have that there. And then you'd hit save. And that way when we start the examination and encounter, all this is already done for us. To the side, it does give us more information too. So if this did change times or anything else, we see the logs of this specific appointment. This is another area you can delete, but like I said, make sure you really want to do that. Sometimes we just need to switch it to canceled, switch it to no show if they didn't show up. That way it gets documented within the chart. So that is a roundabout way and discussion of how the schedule looks. Next thing we will do is dive in on how to actually make an appointment and fill in all of this information.